Hello, I wanted to talk to you about hypertension and the stages of hypertension, and hopefully I'll be able to explain it in a way that's easy to understand due to your family history and what's going on with your long-term sustained hypertension. So there are 3 stages of hypertension, and a simple way to understand the 3 related stages is that if you think of the body's pressure system like a plumbing system, that kind of helps me to just visualize how all of this works. So primary essential hypertension is when there's no one single apparent cause. It's often the result of many small factors that have built up over time. It happens because the blood vessels become stiffer and less forgiving as we age. Gillies, the scientist, explained it that this stage is often characterized by early signs of functional or structural changes in the heart or small arteries. It may be elevated, particularly with environmental stress, which you have in your job, being a police officer. So the body has a volume dial, so to speak, and this dial determines how much fluid the body retains at all times. It's monitoring it. So if the volume levels are off, often due to salt, which affects fluid levels, hormones, or the kidneys' inability to handle the fluid, the heart starts to pump and work harder through stiff and constricted vessels. So that produces less ideal environments. Genetics and family history play a significant role in susceptibility to high blood pressure, which you have in your family history, as well as lifestyle choices such as not exercising, eating salty, fatty, high-carb foods, and being overweight make the high blood pressure even worse. So there isn't one thing in this primary stage that will fix high blood pressure, but or at least right away, but little steps to make changes in your body's balance over time will start to reduce your high blood pressure. So it's preventable. Secondary hypertension is caused by a specific identifiable problem that's going on in your body. So common causes include when the kidneys are unable to balance salt and fluids effectively, hormone issues such as problems with the adrenal glands. The adrenals regulate salt and water, and also sleep apnea, which is characterized by pauses when you stop breathing and you're sleeping. So also certain medications or substances like some decongestants, stimulants, and illegal drugs can cause high blood pressure. So if one of these areas of your body, kidneys, adrenal glands, are not functioning properly, it can push your blood pressure up. Once that root cause is fixed or treated, the blood pressure often improves. So because there is a clear cause, doctors can look for that and then treat the cause directly, which often resolves the stage. Complicated hypertension is the 3rd stage, and this is a more serious long-term. It happens when you've had uncontrolled high blood pressure going on for a very long time, and it started to cause problems in other parts of your body, other organs. Margot, a scientist, talks about this. He says complex hypertension is a term used for those hypertensive patients with clinical evidence of target organ damage, such as ischemic heart disease, stroke, and chronic kidney disease. So the heart, kidneys, eyes, brain, blood vessels, they can all get damaged because they're continually being pushed by high blood pressure. This can lead to heart disease, kidney problems, stroke, or vision issues, among many other things. So the concern here is that the long-term blood pressure which you've had, when it stays high, the risk is bigger for these other major complications in your organs. So it's not just about numbers per se, it's about the wear and tear on your organs over the years. So one pathologic condition I want to address with you, which is involves your kidneys. So a complication of hypertension is called nephrosclerosis, and this term is described has traditionally been used to describe a clinical syndrome characterized by long-term essential hypertension, hypertensive retinopathy, left ventricular hypertrophy, and minimal proteinuria, also with progressive kidney failure. That's a scientist named Fervenza who wrote about it. Basically, the kidneys have many filtering tubes, and nephrosclerosis means those tiny tubes get stiff or damaged, usually because the blood vessels inside the kidneys are hardened or narrowed. And if you think of the tubes inside the kidneys like a garden hose getting crusty buildup inside, the water's not going to flow as well. So it's pretty basic. The same with the kidneys and your blood. The kidneys won't filter the blood as efficiently, and then toxic levels can build up. So this can happen in the kidneys slowly over years with uncontrolled blood pressure, and is most common in people with long-term high blood pressure or diabetes, which you're susceptible to. So high blood pressure is when your heart is constantly forcing blood through tiny vessels that can damage them. Diabetes, it has a similar effect with blood sugar that can injure the blood vessels in the kidneys. Aging, which we're all doing, the kidneys and their blood vessels naturally become a bit stiffer, and other factors such as smoking, obesity, family history, and certain inflammatory or kidney conditions can also raise the risk. So, pardon me. If the kidneys don't filter well, waste and fluids will build up in the body, and these become very toxic, and it can progress to chronic kidney disease in some people. So not a good scenario for you. So how can we reduce your risk to nephrosclerosis? First of all, managing blood pressure. You want to aim for a doctor-recommended blood pressure from your doctor, which usually is 130 to 80 and below, but you may have a different target range with your doctor. So also in your lifestyle, if you could limit salt, eat a balanced diet, exercise regularly, and maintain a healthy weight, those will just be amazing. Definitely take your prescribed high blood pressure medication if your doctor has prescribed them. Control your blood sugar. You're probably you might be a pre-diabetic due to your mom's diabetic history. So really stay on top of that. Monitor your blood sugar. Follow your meal plan and take your medications. Regular eye and kidney checks with your health care provider are very helpful. And then smoking. Don't smoke. If you smoke, seek help to quit. Smoking damages the blood vessels and damages your kidney health. So really important. Also, maintaining a healthy weight and staying active is essential. Even a modest weight loss and regular physical activity can help control blood pressure and improve diabetes management. So you don't need to lose a ton of weight to really have the effects, positive effects. So limit alcohol and avoid illicit drugs. Excessive alcohol and certain drugs can raise your blood pressure and harm the kidneys. So your 5 beers a day definitely are contributing to your high blood pressure. Stay hydrated and avoid dehydration. Drink water regularly, especially in hot water or when you're active. Regular checkups and kidney screens are important. So since you do have these risk factors, high blood pressure, diabetes in your family, and the family history, your clinician may want to check your kidney function, and this is just done through simple blood and urine tests. So early detection helps prevent so much and slow the progression. So when you want to, I would bring up with your doctor about nephrosclerosis. You can talk to your primary, or even go to a nephrologist, which is a kidney doctor. Bring your list of meds, your current blood pressure readings, and any questions about your kidney health to get that process underway. So I wish you well in this. If you have any questions, let me know. And it was great talking to you. Thank you.